I'm your host, Julia Appelskog, and today we will focus on the PV quality management system and how AI is changing the way we are managing it. Can you please introduce yourself?
Yeah, so thank you so much, first of all, Julia, for having me today discussing this topic, which is quite dear to me. So my name is Stephanie Martin. I am the managing director of SMPV Limited, which is a consulting company specialized in helping PV leaders strengthening their pharmacovigilance quality systems and preparing small and medium pharma companies when it comes to inspections.
Thanks. We will speak about PV quality management system, and I suggest we cover three parts. One is what are the recent changes in the conduction of audit. The second part may be see your ideas about the Commission implementing regulation and upcoming changes from February. And then the third part is looking how AI can help us to conduct audits. What are the recent changes in the management of PV quality management system?
So I think we need to look at where we are at when it comes to quality within organization. When I talk to leaders or when we have conversations, everybody is very aware of the importance of quality within pharmacovigilance. I think where there's still potential areas for improvement and some struggle for companies is how do you implement those principles within the daily operations within companies. If we look at latest EMA working group inspections report for 2024, there was still quite a lot of findings that were noted when it comes to quality aspects, whether it was the quality management system, the PSMF, contracts and agreements, etc. So I think there's still quite a lot of work to be done for companies when it comes to implementing the principle of quality within their daily operations.
Where do you see the biggest risk today?
I think the biggest struggle for companies at the moment is how do they align their systems and processes with their quality management systems, and how do they design their quality management systems so they are becoming efficient and not necessarily additional work for the employees. We all know within companies that resources are limited, that they have a lot of activities to be conducted, but on top of that as well, they need to perform some quality activities. The biggest struggle, I think, is how do you train your employees when it comes to quality, and how do you help them to be able to implement the principle of quality to improve the systems and processes?
Do you think the organization start to be more proactive how they manage QMS, or are they still in this reactive phase?
I think there's still a lot of reactivity. I think people are aware of the importance of quality and how they need to be proactive. However, the reality that is being seen is that at the moment is still a very much reactive approach, unfortunately.
Thanks. Let's maybe look for this interesting topic about the Commission implementing regulation that became effective now in February 2026. So why audit has a big part in this, and what are the main changes?
So one of the biggest changing, I think, when it comes to the auditing part comes with contracts and the subcontractors. A lot of companies use their activities to third-party vendors, and that impacts a lot of oversight and governance. But then the reality is that some of those companies may be subcontracting their activities to other vendors. And then the challenge then becomes for companies of how do you oversee all those activities, how you are aware of all those activities that are being subcontracted, and how then do you ensure then the compliance throughout, etc. So I think may just want to reinforce this important part when it comes to oversights and management of activities, and how do they embed not only vendors but also the subcontractors.
Yes. So we have changed from risk-based audit to risk-based interval. And I think everyone has this question in mind. So what is the acceptable risk-based interval? What is the maximum interval? Do you have any ideas from your perspective?
For me, it just really depends on every single organization and how they are being set up. They need to really look at their pharmacovigilance systems, look at what auditable units do they have, how they are being set up, and then really think about, is the risk associated, what type of activities do they do, how long do you have the contracts for, what do you need to evaluate as well. So there's a lot of different pieces with it, but I think it's not like a standard approach for everybody. Every company will have to assess it depending on their own systems and their organizations and setup.
Yes, I agree. It's a little bit how you're saying there is no clear answer, not in the legislation, and also if I ask different inspector in the Q&A forum, and the answer often get like, you as MIH need to define the period, and then we will tell you if it's okay, if it's not okay. So really waiting for the MIA published Q&A documents on audit, they're promising maybe we'll have more clear answers.
Yes, I think it's still a very much ongoing topic within the industry, and nobody really have some clear answers around that. I think everybody's very eager to see the new published GVP updates and the new guidelines that are going to come up in 2026 as well, and just to see what do the regulators say around that and whether they provide any more information.
Oh yes, 2026 seems to be a very busy year for us with a lot of update of the GVP guidance. Almost every single GVP guidance is going to be updated, so we are going to be busy implementing
a busy year ahead.
One more question regarding the auditing and this auditing of the third party. When we work with the vendor and vendor is subcontracting for the MIH, what is the best way to have the oversight, and any tips or recommendations?
It depends of what kind of activities are being managed by your vendor, first of all, and then depending of your process and your system, which role every party has as well. Are you fully outsourcing all your activities? Are you still involved in some of those activities? And then that what kind of oversight you need. So there's different parts associated with it. And then it's really kind of defining then what is the right governance and oversight. What are the key KPIs that you are going to be using? How often are you going to meet with your vendor? What partnership do you have, the relationship, etc. If you just started, it might be different than if you've been using a vendor for a very long time. And once again, it's dependent on the type of activities that they outsource and the model that they follow as well.
Okay, move to the last part of our interview today for the how we use AI in audits, and he also divided by 3 parts. The first one, using AI for the preparation before the audit. Can you provide some example how it could be used?
So when we think about AI for audits, I think one of the biggest help it can give is really around the preparation. So in terms of trying to help with the potentially identifications of the regulatory requirements, it can help as well with looking at the data, starting to maybe help with some training, informations, etc.
From my perspective, using Microsoft package, and then the Copilot is a part of the Microsoft package. And so whenever you have the full license, it could be very helpful because it's really finding the information that's needed for the preparation phase. And doing the search through my documents, emails, and files, I can directly ask and get all I needed, well summarized, well prepared. And also maybe for preparation, it can really help and provide specific questions, so you can be very well prepared before going to the audit.
But again, it's how do you access the data? What availability do you have?
I think recently I opened one of the files, Excel files, and the Copilot was saying, "Yeah, you need to clean it up. Do you want me to help you to clean it up?" So that could be very helpful.
Yeah.
And what's about use AI during the audit? Is it how it could help during the audit?
I think during the audit is a bit similar to the preparation. It can help you to potentially the data, maybe helping you to assess the information, etc. And are we then going to see a change in terms of how the audits are being conducted and maybe requiring then more partnership with the IT auditors, etc.? Systems is taking a bigger part because companies are having more and more electronic systems. And now we have AI on top of it. So it's about, what governance do they have in place? How do they train the data? How are they validating the systems, etc.? All those aspects which are part of the development of the AI tools are things that are going to be potentially asked by auditors and looked into.
Yeah, and it's like you say, a lot of focus on the system and the tools. And I think a few years ago, it was also focused even for the inspection, like GXP inspection. It's come with the GVP, but look for the IT system and similar. The GMP inspection coming and they're looking for the compliance data, PV data. So do you see it more like a mixture of different GXP environment during audit, or it's still a very clear GVP is separate, GCP is separate? And
I think it's still very much separate at this stage, but at the same time, there'll be some overlap as well. And GCP inspections, they're going to ask questions about the PV aspect. In GMP as well, there might be some questions related to that as well that might pop up. So although they might be done separately, there's still a lot of interactions and interfaces, and those are potentially being looked at anyway.
Look at the phase of the auditing when the audit is completing and when the CAPA preparation phase, and the AI help us to write a better CAPA.
So I think, there's some potential to use AI tools to potentially help with the root cause analysis. It can help you by asking you the right questions to maybe help you to identify the right reason for the issue. It can so help with the writing of the CAPAs as well. So there's still lots of different areas as well where AI can help as well. And again, it's still very much early phases. I think we probably need more conversations around those topics as well and see what is happening within the industry.
We actually in our company develop a tool, in-house tool for managing CAPA and deviation for the MP, for the manufacturing, for the manufacturing findings. So it's still not implemented for the R&D. It would be the next step. But it's a really great tool and make a lot of
I think we see a lot around like the GMP world as well, and this is where PV point of view we can learn as well from other areas and what is happening. There's a lot happening in the GCP world as well, so it's how can we learn between different areas and leverage what is being used already. So it's how companies are going to manage and adapt to that, and you're going to then take the opportunity to move towards a more proactive approach.
Yeah. That's great. Thank you for being my guest in the studio today and share your insight in the PV quality management system.
Thank you so much.